some of one or two questions from the UTI. Okay, so when you talk about UTI and want to talk about the areas that constitute, so U is urinary, T is the tract. So if you want to consider the tract is from kidney to the urethra near to it. Kidney. It's like when I ask you about GI. GI starts from the mouth to the anus. So when I'm talking about the tract is from the kidney to the urethra near to it. So when you have organism in the urinary tract with symptoms and sometimes signs of inflammation, we say is what is UTI. The presence of organism in this tract, urinary tract, and I'm saying that the urinary tract starts from the kidney to the urethra near to it. So note this. It's not only the urethra that could be termed as UTI. One is affected. The presence of organism that is in this tract, urinary tract. We have microorganisms in this tract, in this urinary tract. So when you have microorganisms with symptoms and sometimes signs of inflammation, and you conclude that this is what is UTI. So the UTI can be divided into, we don't have the board, so it's of late. I don't know. So the UTI is basically divided into the upper UTI. You have the lower UTI. So the upper tract infection, and you have the lower tract infection. I'm saying that the UTI can be divided into upper tract infection and the lower tract infection. And the upper tract infection includes the kidney. So you have the kidney. When the kidney is infected by these microorganisms, so you could have pyelonephritis. When you have this pyelonephritis, we term it as UTI, but it's upper tract infection or upper urinary tract infection. When you talk about lower tract infection, lower UTI, then you think about the bladder, and you think about the urethra, and also think about the prostate. This also forms the lower tract infection. The lower tract infection. Please, do you understand up to this point?
Yes, please.
So if somebody comes with pyelonephritis, I will explain. It's also a UTI, urinary tract infection. Pyelonephritis is also what UTI. It's affecting the upper tract, upper UTI. So upper tract infection, pyelonephritis is also a UTI. So that is that. So basically, when you have microorganisms causing inflammation in the urinary tract, and we say it's UTI. And I say that the UTI, you could have the lower tract infection, you have the upper tract infection. So the upper tract infection includes the kidney. So when the kidney is infected, it becomes upper tract infection. And when we have bladder, we have the urethra, we have the prostate, it becomes the lower tract infection. These are all UTI. So let's see this. So I said that the tract, urinary tract, I said it starts from the kidney and ends with the urethral meatus. Normally, what happens is that this tract is sterile. Why is it sterile? This tract, what will cause? Looking at all the time, things go. If you take the tract, it's like the tube. If you take the pipes, the tubes that are water, the water that we get from our homes. These tubes water will always pass through these tubes into our home. So this urinary tract also be taking these waste from the system up to the urethral meatus. And I'm saying that those tubes, the tubes are normally they are sterile and they are resistant to bacterial colonization. So bacteria cannot stay under normal circumstances, cannot stay. Despite the fact that there's a frequent contamination of distal urethra colonic bacteria, there's constant flow of contamination, frequent contamination of distal urethra colonic bacteria all the time going through the tract. But we see that the tract, one, is sterile, and two, will resist or has resistance to bacterial colonization. So under normal circumstances, these are the properties. These are the properties. It doesn't mean that this tract is sterile. We are saying it's sterile. It doesn't mean that this cannot be infected. We are saying that under normal circumstances, it's resistance to bacterial colonization. So it's difficult for bacteria to stay along the track. Is difficult. What makes it difficult under normal? I'm saying under normal circumstances. What makes it difficult for bacterial colonization along the track, urinary tract? What makes it difficult? So normally, I'm saying that they resist bacterial colonization and it's sterile. But what it does, it carries contamination of distal urethra colonic bacteria. It carries this. The colonic bacteria gets in there and they are taken out. The colonic bacteria then gets in there and then is carried out via the kidney, the ureters, the bladder, the urethra, then out. But we are saying that the tract, urinary tract, will resist any colonization of these colonic bacteria. What makes it so? Why is it that under normal circumstances, it's difficult for bacteria or any other microorganisms to colonize any area of the tract. Who can tell me one or two? Who can tell me some of the mechanisms that would ensure, under normal circumstances, that would ensure that the tract will resist any bacteria or any microorganisms colonization? Who can tell me some? Can you hear me?
Yes, Doc.
Can you hear me?
Doc, I can hear you.
You understand what I was asking?
Doc, please, let me give it a try. I'm looking at the constant excretion of the waste product from the tract. Now, prevent any colonization of any microbacteria in that environment.
So these constant flow, so constant emptying of the bladder, or constant maturation, or constant voiding, these constant flow would ensure that it will not allow colonization of any of the microorganisms over there. So emptying of the bladder all the time, so maturation or voiding, these constant processes occurring will not allow microorganisms to be there. Please hold on for me. Hello.
Doc, we are here.
See, this constant voiding or maturation, constant emptying of the bladder will not allow time for these microorganisms to colonize. Any other? Any other? Hey, so if in exams, if you are asked about, you say 5. 5 will be too much. Let him say give 3. I'm waiting on. What are some of the properties that this track is having, or some of the activity that goes on that makes it impossible for microorganisms to colonize along the track? Can you hear me?
Doc, please, you can hear you loud and clear.
Hearing one voice. I don't know whether the rest is hearing me.
Yes, please, you can hear me.
So answer me. What is it that so there's urine acidity. The urine acidity also affects. The urine acidity also affects the microorganisms. We have what you call, check it, URV. Check the URV. What is that URV? Check what is that URV. And we have these mucosa barriers. We have mucosa barriers. We have URV. Check the URV. And we have the urethral sphincters. Urethral sphincters. All these properties aid and ensures that microorganisms will not colonize along the track. So, immunological process that goes on within. So this would affect any microorganism colonization. So for UTI to occur, listen, for UTI to occur, bacteria or microorganism, I'm using bacteria, should ascend. If I want to get the upper, I said that we have the upper and we have the lower. So for microorganisms to get into these, whether it's upper or lower, these microorganisms, so if I'm talking about bacteria, these bacteria should ascend. If I'm talking about the upper, should ascend from the bladder to the kidneys. Then it means that now we are having, instead of the rivers from the kidney to the bladder, the microorganisms would ascend from the bladder to where? To the kidneys. And this can cause the upper tract infection. Please, do you get it? And this will lead to this pyelonephritis. So acute, uncomplicated pyelonephritis occurs when those microorganisms or bacteria ascending from the bladder or the ureter to the kidneys. This can develop pyelonephritis. When we want to get the lower tract, then we have microorganisms ascending from the urethra into the bladder. This will cause what? This will cause the lower tract infection. Please, did you get it?
Please, can you kindly repeat for the lower tract infection?
So what did I say? The areas that includes the lower tract.
Please, you said the bladder and the urethra.
The bladder and the urethra. So for infection to occur, under normal circumstances, the flow is from the bladder to the urethra, meatus, then it to be out. But for infection to occur, when the microorganism rather moves from the urethra to the bladder, then this will cause the infection. When there's a rivets of the microorganism from the urethra. Certain things can cause it. We'll be talking about it. But now what I want you to understand is that when we have microorganisms or bacteria ascending, and it's not descending, ascending from the urethra to the bladder, it tends to cause what? It tends to cause lower tract infection. When you have microorganisms or bacteria moving from either the ureters or the bladder to the kidneys, then you'll be getting the upper. So ascending, now the reverse is occurring from either the bladder or the ureters to the kidney. Then this will predispose the patient to easily get these upper tract infection, which is the pyelonephritis. Please, is it clear?
Yes, please.
Yes,
Thank
Doc.
you.
Is it clear to everybody?
Yes, Doc.
Okay, so we could have what you call complicated UTI, and you could have uncomplicated UTI. Let me ask you, if I say complicated UTI, what is that? What is complicated UTI?
Doc, living complicated UTI is a type of UTI which is resistant to treatment.
Somebody is saying complicated UTI is UTI which is resistant to treatment. Any other? Are you ready for the class? Or you want to? You are also joining the photo shoot. Hello, class.
Hello.
Not hearing,
Hello,
I'll
Doc.
stop. Because when I ask questions, it's only one person or one or two. You are about 100 and something. If you are on this and you are doing other things, let me know. Some of your mates are doing photo. And say you have time to do all this. If you want to go and do, go and let me rest. Right? I ask questions and I'm not getting any feedback. No feedback. One person or two has been talking out of a class of one or something. I'm asking about complicated UTI. You have done UTI at school. You have done.
Doc. Doc. For complicated UTI, occurs when the urinary tract infection is caused by underlying factors. And these underlying factors can be caused by either catalyzation or urinary abnormalities. Abnormalities can be caused by either obstruction of the urine flow or poor bladder emptying. Others can also be as a condition that normally leads to poor bladder emptying, including BPH, neurologic bladder It can be urethral prolapse or delayed bladder neck maturation. Tumor or stones can cause surgery. So these are some of the things that can discuss as complicated UTI.
Okay, so you are right. So let me break it down. When you talk about complicated UTI, it doesn't mean that, as Solo said something. Said what? Solo, what did you say?
No, please, I said it's resistant to treatment, please.
When the UTI is resistant to treatment, that
Yes,
is not complicated UTI.
All right, thank you.
Complicated UTI is one. First thing that you should know, underline. The first thing that you should know is that for complicated UTI, there's underlying factors that predispose to the, I told you, to the ascending bacterial infection. There's underlying codes or underlying factors that will cause microorganisms to ascend to cause the infection. So when we have an underlying factors, then say is what is complicated UTI. Any UTI that will be as a result of underlying. We know that this is the underlying cause. We term it as complicated UTI. Please, is it clear?
Yes, Doc.
Yes, Doc.
So predisposing factors. Now we have underlying factors that will cause the ascending. So if it's the upper, it will cause. So let me ask you, if it's the upper, what will happen? The ascending will move from where?
From the bladder to the kidney.
Either from the bladder to the kidney or what?
Or the urethra.
Please, from the bladder or what?
Urethra.
Uretate. So from the bladder or the uretate. So if it's the upper, so we have an underlying factors that will cause the ascending of microorganisms from either the bladder or the uretate to the kidney. That will cause the pyelonephritis. So what are some of the underlying factors or the predisposing factors? Please understand this. Understand this. I'm talking about complicated UTI. And when you talk about complicated UTI, it means there's underlying factors that is causing that UTI. And some of the underlying or predisposing factors to that UTI or to that complicated UTI could be urinary instrumentation.
Diabetes mellitus.
Come again.
Sir, please, diabetes mellitus.
Diabetes. You want to talk about some of the underlying. That is what you want to talk about.
Yeah, I thought you were asking for some of the underlying conditions.
So the underlying condition is you talking about diabetes. Good. Diabetes could be an underlying. But as our brother said, one of our colleagues said that you could have urinary instrumentation. What are some of the urinary instrumentation that could predispose patient to complicated UTI? So we have catheterization. We have catheter one. So it's not advisable to put a catheter on a patient, and the catheter will be there for ages, for months. It should be there for a short time, because these catheters could introduce infection. You can get UTI. You get UTI from these catheters. So it's not advisable. You could also have anatomic abnormalities. You could also have obstruction of urinary flow. If there's an abnormalities and it's causing obstruction to the urinary flow, this will cause colonization, bacterial microorganism colonize along the tract. This can cause the UTI. And when this is causing the UTI, we said that there's underlying factors. And these underlying factors, because we have underlying factors, the UTI will be what? Will be complicated. So when you have poor bladder emptying, it means that the bladder is having issues. There's underlying anatomical abnormalities. There's underlying problem causing retention of urine. This retention of urine can now lead to what? Colonization of microorganisms. Please, do you get it? So for complications, as one of our colleagues said, diabetes. If diabetes is predisposing us to UTI, then the underlying factor is the diabetes. And that type of UTI becomes what? Becomes complicated UTI. So we have uncomplicated UTI. What is uncomplicated UTI? What is uncomplicated UTI?
Look.
Hello?
Hello?
I'm listening.
Yeah. For uncomplicated UTI, there are no underlying abnormalities, no catheterization, or any abnormalities that are affecting the urethra or the kidney. And normally patient. Hello?
I'm listening.
Yeah, so in short, for uncomplicated UTI, there are no underlying abnormalities. That's number one. Number two is there's no catheterization or any abnormalities that are affecting either the urethra or the bladder.
So for uncomplicated, as you said, we don't have any underlying abnormalities, or we don't have any impairment of urinary flow. Nothing is impaired, obstructing the urinary flow. So there's no underlying. So listen, for uncomplicated, there's no underlying. There's nothing that is obstructing the flow. There's no underlying abnormalities. And this is common. This uncomplicated UTI is common in young women and the younger men. Those people are, let me use this word, this unprotected anal intercourse. These young men and women will have this unprotected anal intercourse. So uncomplicated normally affect the young ones. There's nothing like abnormalities along the track. There's nothing like obstruction of the urinary flow. So it tends to affect the younger men and young women. Let me ask you a question. So what is the risk factors for this younger woman to develop UTI? What are some of the risk factors that predispose this woman, or let's see, young women or young ladies to be having these UTI?
Yeah. Look, some of the factors that
Hello? Hello? I am getting Matthias. Matthias, are you there?
Hello, Dr. Attakorah.
Matthias, I want to know the class number. And this, if I have been asking of this, I want to know the class number to know. I know what some of you are doing. Some of you are joining the class without you are giving the links to your friends. Let me know the number I'm dealing with. Matthias, this is the last step. If you call me and I don't come, that will be the reason. Do you get it? Huh? Matthias, I want to know the number. The number, I don't know the number I'm dealing with.
Yes, please.
I was asking about the risk factors for the young ladies to get this UTI. What are some of the risk factors? It's common. What are some of the risk factors?
some of the common ones that normally
Please, I want others to talk.
Okay, so Doc,
One person at a time. You raise your hands, then I'll call you. Okay, Sandra. Is it Sandra or Sandra?
So adrenal bleeding could cause UTI in young
What?
females. Adrenal douching.
So the vaginal douching. Why is vaginal douching causing UTI in young ladies?
It affects the lactobacillus there,
So the vaginal flora will be affected, will be changed. And this will allow that we have commensals, the organisms that are found within the vagina. They are commensals. When I say commensals, what does it mean? What does it mean? So douching, what again?
So we can have sexual intercourse.
So sexual intercourse too. Sexual intercourse could predispose the young ladies. Unprotected ones could. Amma, you want to say something?
Ladies have a shorter urethra. So it
Come again.
a shorter urethra for a woman.
This is general, because that's becoming a risk because you have shorter urethra. Have you checked your urethra?
No, please.
Just tell me the length of your urethra. Samuel Amma, you wanted to say something.
Okay, Doc, I was trying to say that for the common ones, sharing bathrooms of somebody who is infected of the UTI can also let to get that condition. The other one can be that.
Justify it well. I don't want this. When you are answering questions, it's please be careful about it. What is sharing bathroom? If you say sharing bathroom,
I'm saying that sharing bathroom with infected person.
No. This is not so. What is sharing bathroom with infected person? You should say it well, please. It's not bathroom. Is it bathroom?
Washroom. Let them put the washroom. Sharing washroom with infected
What is
person.
washroom? What is washroom?
That maybe you are sharing the same WC.
So use that. Use the WC. Do you get it? And that is the point. The WC, the ladies, when especially girls' schools, they are prone to these UTIs because of the WC. The bathroom, I can go to the bathroom, but if I don't use the washroom, I'll not be getting it. I'll not use the WC. I'll not get it. The ladies tell me, so if we use the same bathroom and we don't use the same WC, can you get these things?
No, sir.
So please, when you are answering questions, get straight. I want that pinpoint. Don't generalize and say, and you want me to, I don't know. Don't let the examiner struggle to get it. Or don't assume that what you're saying, the examiner will get it. Please, get straight to the point. I could share the same bathroom with you, but I will not be using the closet. If I'm not using the closet, I don't think I will get it. Mr. Ahmad, you get it?
Yes,
So please, it's the closet. It's the closet. So sharing the same closet. So we have talked about sexual intercourse. We have talked about right.
And Dr. Please, the closet. I just want to know how that works because you just go and sit and you pee and you get up. So how does the bacteria get there?
You should be able to tell me as a lady.
You just pee into the bowl and then you flush and go away. I don't know how the infection will travel there.
Do you know at times when you are peeing, some of the pee will get to the leg? Do you know that?
Yes, please. Yes, please.
Huh?
Yes, please.
That is why it's advisable when you are going to sit on it as a lady, you should have antiseptics to clean and flash it. Put some in, and you flashed it before you sit on it.
Okay. Thank you.
You are thanking me, so you don't do it.
I still don't get how the bacteria will go because the urine is coming out. So how would that bacteria go inside when that one is coming out? That's why I'm just asking.
I am saying that, listen, you are peeing. Huh?
Okay.
You are
Listen.
exposing that opening to the environment. You get it?
Yes, please.
You sit on it, and if you have any microorganisms, so why is it that you do you know the entry of these microorganisms? I was asking this question. Let me say, I was asking this question. Somebody had organophosphate poison. The person hasn't taken these organophosphate poison, but had this poison. What are some of the entry points of these? If I ask you about these entry points of either microorganisms or these organophosphate poison, what will you tell me?
Say the skin.
What?
The skin.
The skin. Why is it the skin?
So because the skin is permeable.
The skin is permeable.
Yes, please.
So your bottles. Your bottles are metals. Huh?
No.
Huh? So, and the danger aspect is that you are different from the men. You have opening. At times when you are even flashing, you'll be sitting on it and you flash. And there could be a splash. At times you do that. And because it's the skin, there could be a contact. You may not know. These microorganisms, you don't see them. You don't see their movement. So make sure one of the ways by which these microorganisms will get into your system is via the skin. So you, the ladies, you have an opening where small thing can easily get in there. So that is that you don't have the eyes to see the microorganisms. But when you have infected closets, you may not know. What I'm saying is that at times you sit, you flash, and some of these would splash in there. So one advice is that when after easing yourself, when you are flashing, you should close the opening with the lid and you flashed it. And when you finished, then you should use some antiseptics or Dettol and Co, what do you call it, just to clean. Men are a bit different. So it's at times difficult for men to get the lower tract UTI, but the ladies is easy because of the opening. So we have talked about sexual intercourse. We have talked about, what do you call it? Is it douching? Putting things there. What again? Common things that could cause.
The poor menstrual hygiene.
Poor menstrual hygiene.
Pregnancy.
Good. Pregnancy.
So wiping technique.
So wiping technique. Can you tell us the technique?
So you are supposed to wipe from front to back, not from back to front.
Okay, so wiping technique. These are all things that could cause any other.
So can we talk of the wearing of nylon panties or tight
Don't.
panties by ladies?
I'm asking you questions. Don't ask me questions.
Yes,
I'm
sorry.
asking you questions. Don't ask me questions.
Look,
Put things that the things that we say, put it down, because these are something that could come easily orals. These things, orals, these general questions. At times you may not know the way a question will be asked. Then they'll be asking you this general question. And these are asked as the general questions. Ask a lot. So please get to know. So, Solo, you were saying
Yes.
what?
No, please. At times ladies do wear tight panties. These jean strings. I believe it can also cause infection.
So this is not good for them to wear this tight. We need air entry into that area. We need air entry, so it's not advisable. And the way you wash your panties. Hey, let me ask you, ladies. Let me ask you this: when you are in school, where do you dry your panties?
Sir, please, under the sunlight.
You are supposed to do it, but do you do that?
Yes, please.
So you are supposed to dry it under the sun. So you should dry it under the sun. Very important. Any other?
one other common cause is the use of condom and the diaphragm that are treated with spermicide that can cause the increase of E. coli infection.
So you be saying this, then at the end of the day, you say something that will nullify what you said. You said what? E. coli, that would nullify what? E. coli infection. What does it mean?
No, what I said.
You started it well. I was happy. Then
what I said was that the use of condom and diaphragm treated with spermicides can increase formation of E. coli.
What type of condom?
Now we move on to the free education.
Is it the male condom or the female condom?
The female.
So when you are answering questions, I keep on telling you, don't let the examiner suffer. Other than that, the number is straight to the point. Because if you say condom, we have female and we have male.
Female. I'm a friend with female.
So why is it difficult to say female? So in your answering, and this is something I've seen, I keep on telling you, don't make you say this and you assume that the examiner has gotten your point. And you go home and be saying that I've done the thing, which is no. So we have the diaphragm. You know the diaphragm. So a lady was generalizing it and said, do chin also. When you put these things under, these things tends to, I told you, I was asking about what is commensal. the organisms under the vagina area, the organisms, the flora there, they are commensals. So we have the good one and the bad one in the same area. So when you call, each is checking. The ones that could cause the UTI are there. So they are checking each other. So the moment you try to use these douches, these chemicals, at times the ladies will be washing their down there with Dettol, which is bad. It's not advisable to do that. They have a lot of chemicals around that they are using to wash under. The best thing is to use what? Water. It's the best thing to use water. Don't be using any chemicals to cause destruction to the flora. And this would allow the other agents which can cause harm over there to cause it. So when you change the flora, it will allow the overgrowth of this E. coli, which is the commonest organism that could cause the UTI. Any other?
Doc, the use of contraceptives.
Well, with this, I want something common, but you are not touching on it. But why the use of contraceptives will cause UTI? I want something common, and nobody's talking about it.
Doc, another thing is the use of antibiotics.
Antibiotics, and nobody's talking about it. Hey, these are antibiotics. I'm talking about microorganisms, and nobody's talking about antibiotics. So antibiotics use can also change the vaginal flora, and this can also cause. So we have mentioned a lot of things. Antibiotics use, we have sexual intercourse. There's other one. When a patient comes with history of recurrent UTI, is also a risk. Recurrent UTI is also a risk. Talked about diabetes, it's also a risk. So these are the things that the general things that they were asking. They want, especially the oral. This can come in a theory, can come in MCQs. And normally they generally want you to come out. Or these general aspects, come out with this.
Hello, Dr. Saki.
Hello.
Please, I want a little clarification with the pregnancy. Please, how does the pregnancy predispose them? Because earlier in the classes, I heard Mr. Solomon saying that when you pee frequently, you wash the bacteria out. And pregnant women, they're always peeing. So how do they get the UTI?
Are you? How many pregnancies?
So 0.
0, and you know that they pee too
much. Yes, please.
Why do they pee too much?
So those I've met, they go to the washroom very frequently.
Did you ask them? You ask your mom. Did you ask your mom?
So when I had the only June sodomy. That's what they say.
So there's in pregnancy there's physiological changes. A lot of physiological changes that will predispose them to. It's not only infectional. Why is it that at times some will be getting diarrhea, some will be getting constipation? What is happening? So this physiological change, too much physiological change. Why is that some will be vomiting? It's just frequent. It's just what? Pregnancy. Why is all this? Some will be throwing saliva away a lot. What is happening? Hormonal changes. So all these changes can predispose a pregnant woman into getting something that under normal circumstances you will not be getting it. Do you get it?
Yes, please.
Some will come with hyperglycemia. So they get gestational what? Hyperglycemia. You know. Or you don't know.
Except please, I do.
I do. So what I'm saying is that because of the changes, it predispose the pregnant woman to a lot of things. A lot of things. So gestational diabetes could predispose you to UTI. At times, a pregnant woman will not, because of vomiting, because of this nausea, pregnant woman will not be able to eat. And this will predispose, the immune system could go down. The vomiting, did you ask your mom about when she got you pregnant? Did you ask your mom?
No, please.
Go and ask your mom the way she suffered. It's very few women will be having this easy way. At times, majority will go through her, will be having one or two things that will disturb them. A lot of women are developing heart failure after pregnancy. Why is it so? Postpartum. Why is it so? So you predisposed to a change, hormonal changes. These hormonal changes would. So in pregnancy, the complications are too. Only few will be getting things so easy. Others will go through that. So hormonal changes could result to all these things. And this could cause things that we will be not expecting. So have you asked them if a woman is pregnant and they will say that the inner becomes hot, the vagina area becomes hot. Have you heard of this?
No, sir.
So that is for pregnancy. It will change the vaginal flora. The temperature will not be as used to. So in all these are hormonal changes. So that environment will change. The environment will change. Okay, so who can summarize all that we have said about the risk factors? About the risk factors. I want a lady to do it. All that we have said about the risk factors.
Oh, Dr. Attakorah, please, one last one. Please, this is a question. So please, can we say no bathing twice a day can cause UTI in women?
Not bathing.
Yes.
Twice a day. Hey, someone. You are the ladies, you are delicate. you are not like you are delicate. And it could happen. It could happen. Depending upon what you do. It could happen. Assuming you work, you sell things. The ladies, some of them could move from A to Z for the day, sweating a lot, walking in the sun. You could get UTI if you don't bath. Some will be sitting at the office without any vigorous thing, which is fine. But in our setting, a lot of them, because of what they do, it's advisable. So please, it's advisable, it's possible that depending upon what you do, if you don't bath what, you can get UTI. Do you get what I'm saying?
Yes, please. Yes, please. Thank you.
Dependent. You are, thank God you are lucky going to school. And when you just look back, your friends, some of your friends are, our markets. The young ones are selling things, and even where they sit to sell. So it's advisable, please, if you could bath 10 times a day, fine. But the twice should be there for your own safety. Twice should be there. It's good. Okay, let's move on. I told you to do the summary. So Benedicta, do the summary for us. And let's move on to the courses.
So please, I joined late, so can I start from where I joined?
You joined late. And when I joined in late, you joined first year. Tell me what.
So please, when I joined, you were talking about the lower and the upper UTI. And then you mentioned that the lower UTI involves the uterus and the bladder. And then the upper UTI involves the kidneys. So you said that the upper UTI occurs when bacteria moves from the uterus or the bladder into the kidney area. And then they go and cause pyelonephritis. And then after that, you said that you asked us what complicated UTI was.
Just talking about the risk factors for these young ladies to get this UTI.
Okay. The risk factors for ladies getting UTI, we mentioned douching. That's when we douche, we change the normal flora of the vagina, which predisposes the women to getting UTI. And then we spoke about pregnancy, which involves all the hormonal changes. And then we spoke about ladies who are very sexually active, also being predisposed. And then we spoke about men who have anal sex, also being predisposed to it. And then we spoke about how we wipe, that we wipe from front to back, not back to front. When we do it back to front, we introduce bad bacteria into the vagina. And then one of us also mentioned the use of condoms. That contain spermicides. So basically, that's what I remember.
Talked about antibiotic use.
Yes, please.
Hmm?
Yes, sir.
Okay, so let's talk about about this. So let's talk about the causes. The causes of UTI. Causes of UTI. So, what are some of the causes of UTI? The commonest cause of UTI are what?
Bacteria like E. coli.
Come again.
I was saying bacteria like E. coli. Bacteria, example E. coli.
So colonic gram-negative bacteria, aerobic bacteria. The most common ones of these colonic gram-negative aerobic bacteria, they are strains of E. coli. Some of the strains of E. coli. Some of the strains, it's not all E. coli. Some of the strains of E. coli, those who have specific attachment, we call them fimbriae. They have the fimbriae. They can attach hooked to the track. They can attach it using that specific to attach itself to. So certain strains of it, the most common colonic gram-negative aerobic bacteria, and that is the most common. The most common. Once again, these E. coli, they are gram-negatives. You could have under gram-negative pathogens, gram-negative urinary pathogens. You could have that. And this could be Klebsiella. There could be Pseudomonas aeruginosa. Pseudomonas can also do that. And we have some D streptococci. That is the gram-positives. Gram-positives can also cause, gram-positive organisms can also cause UTI. UTI. And there are staff, look, who can tell me the name of the gram-positives that could cause UTI? Who can tell me?
Staph aureus.
Who can tell me?
Doc,
Yes.
you call it Staphylococcus saprophyticus.
So Staphylococcus saprophyticus. The most implicated, commonly implicated gram-positive are Staphylococcus saprophyticus. This is the most frequent implicated gram-positive organisms. Is that? Let him do last thing, then let him do some last thing, then we continue either Monday or Tuesday. So what are, because I say that, listen, because I say that UTI affects the tract from the kidney to the urethra meatus. If I'm talking about UTI, then I should have a broader mind to think about the kidney, to think about the bladder, to think about the urethra. Please, you get me? So we could have classification. You could have classification. So what are the classification of UTI? What are the classification of UTI? So I said that it could affect the urethra. So you could have urethritis. You could have urethritis. Please, do you get it? Urethritis is also what? It's also a UTI. Please, do you get what I'm saying?
Yes.
Yes, please.
What again? Just want to know. I've said one, just want to know.
Cystitis. Hey, cystitis.
Cystitis.
Yes, sir.
You could also have cystitis. Good. What again?
Pyelonephritis.
It's also be pyelonephritis. Good. There could also be pyelonephritis. These are all UTI. So when I'm talking about cystitis, it's UTI. When I'm talking about pyelonephritis, it's also UTI. When I'm talking about urethritis, it's also what? UTI. So don't think that when you talk of urinary tract infection, so when you say urinary tract infection, what comes into your mind? When you talk about at first, when we're talking about urinary tract infection, what comes into your mind? I should have asked you all this. So the classification. So we have what? We have urethritis. When I say urethritis, what does it mean?
So it's the infection of the urethra.
Infection of the urethra. And this could be caused by bacteria. What again? Protozoa, viruses, or what? Fungi. This could be caused by protozoa. This could be caused by viruses. This could be caused by fungi. This could be caused by bacteria. So that is that. We could also have sexual transmitted pathogens that could also affect, that could also cause urethritis. We also have sexually transmitted pathogens. You could have some like chlamydia. You could have herpes simplex. What is this? Can you mute, please? So you could have sexually transmitted pathogens like chlamydia. You could have herpes simplex. You could have Trichomonas vaginalis. All these things could cause urethritis. All this could cause urethritis. We have another classification, and we call it acute urethral syndrome. Acute urethral syndrome. What is that? When I say acute urethral syndrome, what is that? When I say acute urethral syndrome, Have you heard of acute urethral syndrome before? I don't know. When I ask question,
I think it comprises of a lot of organisms.
Comprise of a lot of organisms like what? Like what? I'm also cocoa. Like what?
Both positive and negative organisms. So when in management, you target both organisms when you're doing the management.
What is acute urethral syndrome?
Look,
Mm-hmm.
acute, it is an infection of the bladder, and normally it's caused by bacteria, especially the E. coli. And that's it.
Please don't. I'm talking about urethra. Then you're talking about bladder. If it's bladder, it will be called what?
Cystitis. Okay.
Cystitis. If it's bladder, it will be called cystitis. It's acute urethral syndrome. So come again.
Okay, look. It is a condition that normally leads to urethra irritation, and it may include urethral injuries, and that normally associated with frequent and painful and difficult urination.
So two cardinal things, conditions occurs in acute urethral syndrome. Two cardinal. And normally it occurs in women. Two cardinal. That's what? The first one is what? Two cardinal conditions that occur in acute urethral syndrome is what?
Irritation of the urethra.
It's two cardinal conditions that occur in acute urethral syndrome. They are
dysuria.
So dysuria, good. What is dysuria? What is dysuria?
So dysuria is a painful or burning sensation during urination.
So painful during urination. What again? Two conditions, dysuria and what?
Painful sexual intercourse.
What?
Pains during sexual intercourse with respect to the ladies.
Yeah. Are you speaking from your mind?
Yes, please.
We are learning. We are learning. You don't just, if you don't know, then you shut up.
Yes, sir.
Somebody could easily pick it. I'm talking about acute urethral syndrome. And two, it's normally occurs in the ladies. That is why you are saying painful and then it occurs in ladies normally. And I'm saying that two things, two conditions.
So the other one is frequent urination.
So the one is dysuria and what? It's DP syndrome. They call it DP syndrome. What is the P?
Polyuria.
What is the P?
Pyuria.
Pyuria. Pyuria. It's not polyuria, it's pyuria. And we call it DP syndrome. DP, what is pyuria?
Pass in urine.
So parts. So what will be the color of the parts? What will be the color? So acute urethral syndrome, you'll be having I'm making it so simple, DP syndrome. And this could be due to bacteria or could be due to urinary pathogens. Urinary pathogens. Urinary pathogens. Please hold on. Hello.
Hello.
Okay. So we're on what? The organisms that could cause the DP syndrome, acute urethral syndrome. So you could also have N-gonorrhea. N-gonorrhea. Okay. So the next is cystitis. Cystitis. We say cystitis. When you say cystitis, what does it mean? We said inflammation of the bladder or bladder infection, cystitis. So let me ask you, in women, cystitis could be caused by what? In women, cystitis could be caused by what? In women, cystitis could be caused by what?
It
E.
can
coli.
be caused by sexual intercourse.
Can be caused by sexual intercourse. So when cystitis is caused by sexual intercourse, we call it, what type of cystitis is that?
Honeymoon cystitis.
Call it honeymoon cystitis. Good. We call it honeymoon cystitis. So in women, they easily get honeymoon cystitis via what? Via sexual intercourse. So cystitis, normally women will get cystitis as a result of what? As a result of sexual intercourse. And when a patient is getting sexual intercourse, then getting cystitis as a result of sexual intercourse, we term it as honeymoon cystitis. Honeymoon cystitis. So in men, how will men get these cystitis? How will men get these cystitis?
Doc, it's not men normally get it as a result of inflammation of the bladder.
How will men get cystitis? Cystitis is what? When I say cystitis is what?
The infection of the bladder.
So when I'm asking how would, then you're also telling me the same thing. You're telling me the meaning of cystitis. How would men? We say that women will normally get honeymoon cystitis. I'm asking about the men, and you're telling me infection of the bladder. You haven't said anything.
What is cystitis? That's how I define it, please.
No, I'm talking about Amma. Amma was saying infection of the bladder. How will men get cystitis?
So when they have anal sex,
Anal sex, anal sex will get cystitis.
Or through fertilization.
So it's as a result of the ascending infection from the urethra or from the prostate. And it could also be as a result of these secondary, it could also be as a result of secondary to urethral instrumentation, catheterization. So catheterization can also cause that. Also as a result of ascending infection from the urethra or the prostate. That is that. The last one is pyelonephritis. Acute pyelonephritis. What is pyelonephritis? What is pyelonephritis? So pyelonephritis simply is a bacterial infection or infection of the kidney parenchyma. When I say parenchyma, the kidney cell. So if we have kidney parenchyma cells getting infected, so we're talking about pyelonephritis. It's not common in men, it is common in women. It's not common in men. Normally, women developing community-acquired bacteria. So when you develop community-acquired, you have infection community. You acquire this infection, bacterial infection. This could also affect the kidneys. It could also be as a result of obstruction to the urinary flow. And what are some of the things that could cause obstruction to the urinary flow?
BPH.
There could be BPH could cause obstruction. What again?
Urethral stricture.
So strictures could also cause that. What again? Strictures could also cause that.
So please, can we say kidney stones?
The stones could cause that. Calculi. Kidney stones can also do that. What again? Obstruction to the flow.
Pregnancy.
Yeah, pregnancy. What could cause obstruction? We are talking about pregnancy, are they? We call something neurogenic bladder. So we could have tumors. Common things are intimate mama junior. You could have urinary stones or calculi. Pictures are also there. You could have tumors. And we call something neurogenic bladder. What is neurogenic bladder? What is neurogenic bladder? Neurogenic bladder. What is that? Neurogenic bladder. What is that? So pyelonephritis could also be caused by cystitis. Pyelonephritis could also be caused by cystitis. Pyelonephritis could also be caused by cystitis. What is neurogenic bladder? What is neurogenic bladder?
So neurogenic.
Continue.
So a neurogenic bladder is a bladder refers to a bladder dysfunction which may be caused by a damage to maybe the nerves around the bladder. So the patient may have urinary incontinence or urine retention, or there may be frequency in the urine.
So find out more about that. You could also have UVR. I told you to find UVR. What is UVR? What is UVR?
Urine residual volume.
Again. Hey. Again, I can catch them. VUR is what? VUR.
Vesicourethral reflux.
What is that?
Okay, so at the junction between the ureters and the bladder, there's something they call the that's where we have the vesicourethral reflux. So it prevents the reflux of urine back into the kidneys.
So that is that. So all these. So we had urethritis. We have acute urethral syndrome. We have cystitis, and we have acute pyelonephritis. All these are classification of what? Of UTI. All these are classification of UTI. Okay, so next time I will continue with the UTI, talk about the clinical manifestation of UTI, talk about the diagnosis. Then we end up with the management, then that will be all. Okay, so good night. Bye.
Good night.
Sound sleep.
Okay,
Good night, Dr. Attakorah.
good night.
Good night.